Hello, and welcome to our demonstration of CareReport, a modern application for patient safety, incident reporting, and learning. This application was developed within the Center for Health Policy at Imperial College London and leverages all of the output from our 3-year National Reporting and Learning System Research and Development Program. Let me just start by saying what we set out to accomplish with the CareReport development. In short, it was a platform which would embody the output of all of the research and development, but could be deployed globally, leverages new technology and new interfaces, and the power of behavioral insights. The focus here, however, is mainly on building an integrated system to empower all facets of reporting and learning. Keep in mind while I go along that this is just a demonstration, but the system is deployable and ready for use. Most parts of the system can be customized in regards to the taxonomy, landing page widgets, branding, and other components. One of the main aims of CareReport was to show how easy and quick it could be to report a patient safety incident. I'll now play a video which shows an incident being reported, in this case, an incident of a retained swab. I'll just point out a few things as we go along. So here you can see that we have search capability for types and subtypes. This allows us to get to those most commonly used and reported categories. Keep in mind that the reporting questions can be customized to your organization, and this, of course, is just an example of a minimal set of questions. For the patient screen, you can see that we have an input box, which allows us to capture patient ID. In addition to this, we also have an indicator for mental harm. We have, of course, also kept the free text description here, as this tends to hold the richest amount of data, and we've brought in techniques to harness that data. In addition to being able to search across the free text description, which I'll show you a bit later, we're also using the power of natural language processing to link the incident description to related feedback. In this case, once the incident has been submitted, you will see that we have linked it to a case of a retained swab. In addition, CareReport crucially leverages mobile interfaces, which should make it easier to report incidents as they occur and across sites. Mobility was a highly desired attribute of the system according to our survey. CareReport addresses this by being fully available both as a native application or as a touch-friendly web application on all mobile platforms. The user experience is kept the same, however, across all platforms. CareReport not only brings into play the ideal of fast incident reporting, but also incorporates the learning and feedback loop as required by a true reporting and learning system. One of the key outputs of our R&D was that feedback and learning were of utmost importance to the reporters. Here you can see that for our retained swab event, we have a linked learning bit which shows a central alert relating to retained swabs. This learning is immediately available and shows just how important the event is, as it's already been linked to a national alert. We are automating the links between the central alerting system and the text description so that this type of linking is done automatically. Learning will also help to facilitate improved interaction and input into the reporting system as a contribution to improvement rather than simply an obligation to report. In addition, we can have embedded videos which make learning more interactive and informative. I'll play a short video on surgical site infections just to give you an example.
The National Institute for Health and Care Excellence have produced recommendations on how to prevent surgical site infections that you can follow. So what is a surgical site infection? A surgical site infection is defined as being present when pathogenic organisms multiply in a wound, giving rise to signs and symptoms of infection, like fever, pain, redness, and raised white cell counts on blood tests. How can surgical site infections be prevented? Before an operation, patients and their families should be given information on how they can prevent infections. A patient's MRSA status should be known before surgery, and if found possible, they should have the local MRSA suppression protocol, which often involves a nasal ointment, antiseptic body wash, and sometimes antibiotics. Patients should be advised to shower or bath using soap on the day or day before surgery.
As you can see, videos can be much more informative than just text-based CAS alerts, another example of more modern technology being integrated. It's crucial as well that the learning is customizable at any level of the platform. This is why we developed an interface which allows us to set this learning as required by your organization. This builds tighter relationships between reported incidents and the learning from those incidents. Building on the ideal that the reporter should be able to interact within the space of learning and feedback, we also added the feature to immediately view similar reports. This shows us that the system actually understands the user input, which is crucial to continued use of the reporting system. It also provides more feedback for the reporter because they can also add this data to dashboards as required. The ability to view similar incidents isn't just limited to the reporter, however. This functionality is a fundamental part of the ability to perform smarter queries, leveraging the power of newer technology and advances in understanding of natural language. As an institutional risk manager, you can use this powerful facility to search through all the text descriptions for your institution. The central alerting system could also use this to create national alerts as required. Here you can see we've used a smart search to not only find incidents of retained swabs, but also incidents which mention swab counts. For example, the latter search gives us 65 incidents, which is a 300% increase in reports over the 16 we would have found for retained swab only. Probably one of the most important facilities for both reporters and reviewers, of course, is the ability to quickly and directly visualize the data that they are handling. This facility empowers people at all levels to produce unique insights for themselves and at a local, organizational cluster and national level. The system also leverages these reporting trend techniques to create powerful yet customizable landing pages for risk managers, which can give quick insight into meaningful trends at the local level of incidents, which are a high priority and are independent of your traditional categorizations. Once these key items are identified, the platform is integrated to allow risk managers to quickly amend classifications and produce reviews, which then can produce additional feedback to the reporters. In addition, you can add attachments for mandatory reporting as required. These features effectively make every incident report a live document so that the reviewer and reporter can enrich the overall report and both be kept abreast of any changes. Once the report has been reviewed, the reporter gets notifications telling them that the report has been reviewed along with reviewer feedback. This lets the reporter know that their input has been valued and provides additional learning. In addition, the notifications could be a way to communicate to the reporter that there are activities in relation to their input, such as team meetings and/or internal and external seminars. These tools are simply widgets, of course, which can be customized as required. As I showed earlier, we'd also like to propose, for the purposes of this demonstration, to include the possibility to capture a patient ID, which will allow for further learning and research by connecting this ID to other data sources, such as local clinical data and/or national level data such as primary care and secondary care data. This will provide much needed context for the patient in relation to his or her safety. The patient ID is stored double encrypted and will only be resolvable at the local level under the provision of a local authorizer for decryption and linking. Some more advanced technologies that have been integrated into this system include things such as semantic correlation, which allows us to look at related incidents by language patterns rather than just taxonomy level classifications. We have also leveraged automation for the degree of harm based on classifiers, which allows us to give an independent yet repeatable view of harm. Here I can show you how leveraging modern text searching in a database can provide better results. This, of course, is invisible to the person doing the searching, but here you can see that by stemming the word infection, we can automatically match many different uses of the root word infect, which is leveraged when searching for infected wound and/or wound infection. We also, of course, need to have a single user experience across all platforms and devices. Thank you for listening to the demo. If you have any further questions or would like to set up an on-site demo, please contact me at j.symons@imperial.ac.uk. Again, that's j.symons at imperial.ac.uk. Thank you.